Oh, yeah, there you go. We got a couple of nice folks here to talk to us today about some misunderstandings we've got with the Veterans Affairs Committee. Dr. Sharif in the hall, close? All right. And Mr. Joshua Jacobs. We want to welcome both of you, and we hope you can give us good answers to the questions we have. The subcommittee recognizes and appreciates the work done by the Veterans Administration. We know that since the PACT Act, enrollment in the VA healthcare has grown significantly as we provide earned benefits to our veterans. Unfortunately, the inability to accurately forecast is hindering these efforts. In July, the VA alarmingly notified Congress of a potential $15 billion shortfall, including $12 billion in fiscal year 2025 for the Veterans Health Administration. Oddly, VA opted to notify Congress of this immediately following the House and Senate marked up bills for the fiscal year. Given the dire emergency expressed by the VA of the potential September lapse in pensions, disabilities, and education benefits, Congress quickly acted and passed the Veterans Benefits Continued Accountability Supplemental Appropriations Act. Unfortunately, we recently found out that none of the nearly $3 billion provided in that act was utilized in fiscal year 2024 as intended. In fact, the VA carried over $5.1 billion into the new fiscal year, or the next fiscal year. This inability to accurately forecast is unacceptable. The VA's irresponsibly insisted fear that benefits and pensions would be interrupted for American veterans caused us certain concern. That brings us to today's primary hearing topic, to discuss the VA's request for $12 billion in additional funds for Medicare account in fiscal 2025. Failing to immediately utilize the $3 billion as indicated, it's kind of a natural question that we would have as to the accuracy of your predictions. So we will also remain steadfast in our commitment to our veterans, and we'll make sure that they receive the benefits they have earned. But current estimates continue to raise questions. We hope we have a candid conversation this morning on this request, and we look forward to hearing from you. Ranking Member Wasserman Schultz, I will now yield to you for any opening remarks that you would like to make.
Thank you, Mr. Chairman. I thank the gentleman for yielding and welcome Dr. Elnahal and Mr. Jacobs, and thank you both for being here today and for your service. So we're here to discuss some of the budget challenges that VA is facing as they work to accommodate the growing number of veterans who rely on services by the department, which is a good thing. Before we get into that, I want to quickly walk through how we got here today. 2 summers ago, we passed the PACT Act, which was the largest expansion in a generation of healthcare and disability compensation for veterans who were exposed to toxic substances during their military service. We also created the Toxic Exposures Fund, or the TEF, which ensured that these expenses would be covered on the mandatory side of the ledger because our veterans deserve to have certainty that all of their qualifying needs will be taken care of year after year. And when we make promises like the PACT Act, we must keep them. Since the passage of this bill, the Biden administration has worked tirelessly to make sure that veterans who qualify receive the benefits and the health care that they deserve. The administration has been so successful that VA has seen a 37% increase in veterans enrolled in VA healthcare and serviced 7.5 million more healthcare appointments than last year. Additionally, VA processed over 2.5 million disability benefit claims, a 27% increase over last year, and those claims are being granted at higher rates. And this year, veteran trust in the VA has reached an all-time high of over 80%. Clearly, the PACT Act is working. Such success, though, does bring challenges, and one of those is predicting how much it will all cost, all of this will cost. Now, I recognize how difficult that can be, but it's also incredibly concerning that the VA incorrectly estimated its costs. In June, VA told us that there would be major shortfalls in both VBA and VHA. In fact, at that time, VA told us the shortfall would be $2.8 billion for VBA and $12 billion for VHA. VA also told us that the $2.8 billion for VBA was urgently needed by September 20th of this year. So Congress quickly worked to appropriate this funding, only to find out 2 months later that VBA had more than enough carryover to cover all of its needs for the year. Now, while I join my colleagues in asking the tough questions as to how we got here, it is important to understand a key fact here. The fact that VA did not need the full supplemental is rare. In this case, a government agency actually needed less money than anticipated and was still able to provide high-quality benefits and care without going over budget. Now, some of us have been in this Congress where we've had to go and pass appropriations because an agency overspent their money, including VA, a number of years ago. And Judge Carter and you and I were in that Congress, and so we've dealt with overspending line items. In this case, we have a situation where they actually spent less. I would always prefer that an agency, particularly one as important as the VA, try to make sure that they have all the money they need to serve our veterans, rather than them spending like drunken sailors, overspending their line items, and then we have to rush in and appropriate more because they've overpromised and not delivered in the way that they should. So we should be digging into the VHA shortfall because, quite frankly, we need to re-examine your $12 billion estimate. And I know you're taking a closer look at that number and you're awaiting OMB's review, but it's absolutely essential, as you and I spoke about, Dr. Elnahal, that your new estimate be as accurate as possible. In addition to managing the 37% growth in participation, VHA is also facing the rising costs of healthcare, which I think all of us understand is occurring, which adds to the uncertainty around your budget needs. So we'd like to better understand what those cost increases are. I feel confident in saying that we're all here to support all of us. This committee has repeatedly shown that we're all here to support the needs of our veterans. We want to ensure that we keep our promise to care for those who have served in our nation's military and for their families, caregivers, and survivors. But what truly worries me in the coming year is what the incoming administration is saying about, quote, government efficiency. By threatening to defund unauthorized programs, $119 billion in VA healthcare is on the chopping block. Everyone needs to understand that cares about our veterans. Congress must not delay our work into next year. I think as appropriators, we all prefer an omnibus bill to a CR. We should be passing full-year appropriations bills, and we should be working on them right now so that we fully fund the benefits and care our veterans have earned. However, here we are 1 month away from the expiration of the continuing resolution, still without any top-line agreement. And at the same time, we need to appropriately fund all of our non-defense programs so that we're not constantly facing shortfalls and requiring supplementals just to fund our government's basic functions. Responsible governance requires taking care of our veterans' needs inside the VA. And I hope our friends on the other side of the aisle continue to keep that in mind. And I look forward to your testimony, and I yield back the balance of my time.
We've been joined by the ranking member of the Appropriations Committee, Ms. Rosa DeLauro, and I'm happy to yield to you for any opening remarks you consider to make.
Thank you so much, Chairman Carter, and I appreciate the opportunity to be here, and thank you and Ranking Member Wasserman Schultz for holding this important hearing on the potential shortfall for the Veterans Health Administration. Again, my thanks and a warm welcome also go to today's witnesses, Undersecretary for Health, Dr. Elnahal, and Undersecretary for Benefits, Mr. Jacobs. Thank you for appearing today, and I look forward to your testimony. While today's hearing covers a vitally important topic, I just have to echo something that the ranking member said. I really am dismayed that the committee is disinterested in completing the work of the Appropriations Committee on time. We do sit 1 month from the expiration of the continuing resolution that we passed in September, and the date is December 20th, and we, to date, do not have a top-line agreement. What we should be doing, this committee and the Congress, really laser-focused on finishing appropriations bills that we ought to have become law before the end of the year. There are some of my colleagues who want to delay our work until well into next year, and they would like to pass another continuing resolution. Well, continuing resolutions are never a good way to fund the programs and services that our veterans depend on. We need to properly fund the government so that we're not constantly facing shortfalls, needing supplementals to keep the government functioning, to ensure veterans receive the health care services that they are entitled to. So Congress needs to do its job. My view, let's not adjourn without enacting full-year appropriations bills. Democrats are at the table and ready to negotiate on a final full-year bill that can gain the support of Democrats and Republicans in the House and the Senate, for that is what is needed in order to keep the government open. So I really do implore the majority to join us. On the topic of today's hearing, thanks to the successful outreach efforts of the Biden administration, the VA is serving more veterans than ever before, but that increase in beneficiaries, in addition to the rising cost of health care, has led to a funding shortfall for VA medical care. This is a success story, and we should applaud the Biden-Harris administration for ensuring America is upholding its promises to our brave veterans. Over 2 years ago, we enacted the PACT Act. We promised veterans that they would receive benefits and medical care that they require after exposure to toxic substances with dedicated funding. And we extended that to all veterans, all of them. And thanks to the administration's outreach to veterans entitled to the care, the number of veterans seeking care from Veterans Health Administration has increased beyond projections, necessitating additional funding to bridge the gap. In fact, more than 760,000 veterans have enrolled in VA health care since the PACT Act was passed, which represents a nearly 37% increase compared to an equivalent period before the legislation was signed. So we must provide this dedicated funding to uphold our promises. Our nation's veterans laid down their lives, their bodies on line for this country's freedom and security, and we talk about it all the time. We pride ourselves in talking about these issues. We take pictures with veterans. When we go overseas, we take pictures of the young men and women who are serving abroad for this thing. So they are entitled to this care. We said it was there. They now have said, hey, I need the care. So we need to ensure that this care is provided for. This should be nonpartisan and non-controversial. Before I conclude, let me address the VA benefits supplemental that we passed in September. While it remains clear that there is a large resource gap that we must take steps to address to ensure our veterans receive the benefits and the care that they deserve and they're entitled to, I'm concerned by the department's apparently unnecessary request for an expedited $2.8 billion for Veterans Affairs, which was in fact not needed prior to October 1st. Quite frankly, it does make it more difficult for this committee to pass and provide the necessary supplemental appropriations if we cannot be confident of the accuracy of what agencies are telling us about their need and when they need it. So I look forward to receiving more information about how this costly error occurred, what steps the VA is taking to ensure that future estimates are as accurate as possible. Having said that, the purpose of today's hearing is on VA health care, and I look forward to a robust discussion on how we can support our veterans' health needs. We stand together, as the ranking member pointed out. There is no difference of views as to our support and our dedication to the young men and women who have fought and served this great nation. So, but that means we send them off with a blare of bugle and a ruffle of drums, but we have to deal with the issues that they face when they return. And we must ensure that we uphold promises that we made to our veterans. Thank you very much for being here. I yield back.
Thank you. Thank you, Madam Ranking Member. We thank you for your hard work. Mr. Chairman Cole could not be here today because he had something that interfered with his ability to do, but he did send written statement, which, without objection, his prepared remarks will be included in the record. Without objection, your entire written testimony will be included in the record. Now I will recognize each of you for an opening statement, and then we will proceed with questions. Dr. Erna Hall, you may proceed.
Thank you, Mr. Chairman, Ranking Member DeLauro, Ranking Member Wasserman-Schultz, and members of the subcommittee. Thank you for the opportunity to testify today on the ongoing budget needs for the Veterans Health Administration to continue serving our nation's veterans. Since President Biden signed the PACT Act, we provided veterans with more care and more benefits than ever before. We know that VA care is the best and often the most affordable care available to vets, and that those in our care are less likely to be lost to suicide. That is why we have opened the door to VA eligibility for health care at every possible turn we could under this law, launching the most aggressive outreach campaign in history to educate veterans about the resources available to them. Thanks to the resources provided by Congress and our relentless efforts to reach more veterans, we exceeded even the most aggressive projections for care delivered last year. At the end of fiscal year 24, nearly 800,000 veterans had enrolled in VA healthcare since the enactment of the PACT Act, a 37% increase over the period prior to the PACT Act. Additionally, over 900,000 veterans saw an increase in their priority group, meaning reduction in their copays and qualifying for more services like dental and long-term care for many veterans. We also set an all-time record for appointments delivered last fiscal year, all while driving down wait times for primary care and mental health. And these trends have continued in the initial weeks of fiscal year 2025. At the same time, VA care continues to outperform non-VA care in external care reviews around quality and patient safety. In fact, the most recent CMS overall hospital quality star ratings show that nearly 60% of VA hospitals were rated 4 or 5 stars, compared to only 40% of non-VA hospitals. And for 10 quarters straight, we have outperformed our counterparts in the CMS HCAHPS survey measuring patient satisfaction with inpatient care. And most importantly, we've increased veteran trust in VA healthcare, reaching an all-time high of 92% trust for veterans who receive an outpatient appointment. These outcomes are the direct result of hard work from our frontline employees and leaders alike across our system. Through a series of access sprints earlier this year, teams made it easier and faster for veterans to access VA care by offering night and weekend clinics and by increasing the number of veterans scheduled into daily clinics. Today, we continue to see their impact in shorter wait times for primary care and mental health. And through the Referral Coordination Initiative, we're working to maximize the number of options we offer to every veteran, including more VA options alongside community care options when they qualify. And veterans have voted with their feet, often choosing these VA options even when they did qualify for community care, contributing to a slower growth of referrals in the community over the last few years. Our clinicians have also become more productive, achieving a 9% increase in productivity per clinician since pre-pandemic levels in 2019, and a 7% increase in physician productivity specifically in fiscal year 2024 alone. While we're optimizing every resource provided by Congress to deliver world-class care to vets, we also face many of the same cost challenges as the private sector. In fact, the cost for drugs and medicine in fiscal year 24 increased by just over 13% compared to the approximately 9% increase that was estimated at the time of the 2025 President's budget. And we continue to estimate further cost escalations this coming year. Because of our aggressive efforts to manage responsibly within the budget, VA achieved this historic growth in veteran care while staying just under the FY24 enacted budget. We stayed within the budget, an outcome that we did not expect when we initially submitted our supplemental request to Congress this past July. However, many of the strategies we used are not sustainable in the long run. For instance, we cannot continue to delay medical equipment purchases year over year, and we continue to believe that growth in staff, rather than attrition, is needed to meet increases in veteran care demand. Due to the updated information about our financial position at the end of last year, we're continuing to evaluate our FY25 funding requirements, and we now estimate that we will need less than the amount that we requested in July. With more updated information, we're analyzing our revised funding need carefully and methodically, and we will share the revised need with this committee as soon as we finalize it with OMB. If VA medical care does not receive additional funding in FY25, VA will be forced to make difficult decisions to remain within the current budget, most notably on outreach, care coordination, and more. That is why our excellent field leaders have been briefing you and your teams this week about the real and specific impacts to veteran care if VHA is not afforded additional resources this year. To conclude, the most important reason we need more resources is our record in delivering more care and more benefits to veterans than ever before, and our hope is to continue this historic level of outreach and care delivery, and we appreciate the consideration of this committee. I look forward to your questions.
Mr. Jacobs?
Good morning, Chairman Carter, Ranking Member DeLauro, Ranking Member Wasserman-Schultz, and members of the committee. I appreciate the opportunity to appear before you today. As you know, VA is currently delivering more benefits to more veterans, family members, and survivors than ever before. This historic success stems from implementation of the Sergeant First Class Heath Robinson PACT Act and our unprecedented proactive outreach to connect veterans with the benefits that they've earned. This summer, VA identified several factors that required us to reassess our FY24 mandatory funding needs, largely driven by an increase in the total number of anticipated disability compensation and pension claims. Our goal was to ensure sufficient resources would be available to carry us through the end of the year and deliver on our promise to provide veterans and survivors with earned benefits, on time and without interruption. We were mindful that a funding shortfall of just $1 would have prevented VA from processing its September pay file, delaying monthly disability compensation, pension, and education benefit payments to the approximately 7 million veterans and survivors who rely on them. When we recognized the risk of exceeding our performance targets and jeopardizing timely payments, VA notified the committee and kept Congress apprised of developments in the subsequent months. Veterans and survivors rely on these payments, and any delay could have been devastating to them and their families. This was a risk we simply were not willing to take. And slowing benefits delivery was not an option, because we know the transformative impact these benefits have on the lives of veterans we serve. Veterans like Dave Hale and his wife, Carrie. 3 years ago, Dave survived a vehicle collision with only minor injuries, but months of persistent neck pain ultimately led to a diagnosis of a rare cancer. Following Dave's diagnosis, Carrie quickly became his caretaker. Dave's claim was denied, but Carrie didn't stop fighting. After attending a PACT Act outreach event and working with both VA employees and advocates, she got the help she needed, and Dave's cancer was finally granted 100% service connection in June of 2023. In his final days, Dave's only worry was his family. And comforted by the knowledge that they would be taken care of, Dave passed away less than 2 months later. This is the power of the PACT Act, life-changing support for veterans, their families, and survivors. And Carrie and Dave's story is just one of millions that demonstrates the impact of this historic law you helped to pass. Since the PACT Act was signed into law, VA has approved more than 1.3 million PACT Act-related claims, equating to over $8 billion for veterans and survivors. In fiscal year 2024, VA delivered an all-time record $187 billion in benefits to nearly 7 million veterans and survivors. We also processed more than 2.5 million disability benefits claims, a 27% increase over last year's all-time record. And thanks to the largest, most aggressive outreach campaign in VA history, veterans, family members, and survivors are applying for and receiving a variety of benefits at higher numbers than ever before. We are grateful to Congress for providing the supplemental funding we requested. While those funds were not immediately used, prudent management compelled VA to request the funding so veterans' benefit payments could continue without interruption. In October, the amount of the supplemental funding and more was used, directly providing disability compensation, pension, and education benefit payments for veterans' families and survivors. Moving forward, we're incorporating lessons learned to adjust our budget projections, including estimates for the 2026 President's budget, so we can avoid this situation in the future. That means accounting for the capacity of our workforce to deliver at record levels, anticipating higher rates of annual growth in average disability ratings, and continuing to transparently share our status of funds reports every month. We will provide updated estimates when they're finalized and will continue providing these monthly updates to the committee. We remain focused on delivering more benefits to more veterans and survivors more quickly than ever before, and we thank you for your continued support. I look forward to answering any questions members of this committee may have.
Thank you, and we appreciate you being here to explain this. And I don't think anyone sitting at this dais would disagree that we are very proud of the way the VA is reacted to the PACT Act and the way that you've done a great job to take care of our fighting people. But what the question we have here is communication with the people who pay the bills. That's us. And accurate as can be communications. And I would like to hear, and I hope everybody else would like to hear, exactly how you make your estimates. And I'm going to have a question about that. What do you use to make these decisions? It was sort of coincidental that we got this information one day after the presidential election was called. And so that seemed a little circumstantial, as we would say in the courtroom. But anyway, we're concerned about it. And we still don't have a real number. We're talking $12 billion right now as you study it or as you talk to OMB or whatever's coming up. We need clear communications is what we're talking about, because this is a lot of money. It's a lot of money on a short fuse. Nobody's criticizing you that you are accomplishing great things at the VA. You are. But we have to pay the bills and we have to know what's going on. That's what this is. At least I'm trying to shorten what we're thinking about. We're talking about why are we in the dark? And if you don't know, then you don't know. But we're going to have the same situation. We'll have timed on each question, and I'll start, and then the ranking member will follow me, and then we'll go as you came into the hearing. Our office was briefed earlier this month about the status of the funds and projections for VA's funding for FY25. And as I mentioned, it is oddly coincidental that one day after the president's election was called, you told us about the $12 billion. This raised a flag. There was something was strange about that. And OMB said OMB is working on it. Your statement continues that we're at the same place. OMB is working on it right now. According to your response to the letters we were sent, VA projected that you would have nearly $12.5 billion unobligated funds carried over into FY25. Now that we are more than halfway through November, please tell us the burn rate fiscal year to date and the latest on the projections for the remainder of the year. While we appreciate that you relayed to us the $12 billion shortfall as an overestimate, you still said more funds would be needed as you projected to the end of the year. When do you expect to provide the revised number to us so that we can resolve this matter. It is critical that the VA answers us so that we can assess this matter swiftly. Veterans and this body deserve to have honest, transparent, and documented budget needs to enable us to provide the great care to all of our veterans. How do you anticipate this request to come forward? And the final proposal of moving to the mandatory side is not viewed by at least this side of the aisle as a viable option. So with that, if you would answer the questions, is how do you make projections? And you say more projections are going to be made, and give us an example of how they will be reported to this body so that we can have a continuing idea of where we're going to be. Appropriating in the dark is very difficult for appropriators, and we would not rather not do that. So if either one of you would like to give us what device you use to make projections, it would be of interest to me.
I'm happy to start, Mr. Chairman. I think you're more than right to demand transparency, or it's our constitutional obligation to grant you that transparency, which is why in July, when we were mid-year, not knowing where we would necessarily end up, we came forward with our projected funding need into the end of fiscal year 25. So we went as much in advance as possible with that request. That estimate has proven to be an overestimate, as you said, based on the data up to that point in the fiscal year on our care execution levels, on things like the cost per full-time employee. As we briefed to your staff, we were off by about 2% on ultimately what the cost per full-time employee was, amounting to about $3,000 per employee. But because we have a more than 400,000 person workforce when amortized over the entire organization, that ended up being well over $1 billion of costs that we didn't actually obligate when we expected to in July. And so that's one reason that our estimate was off. In the coming weeks, Mr. Chairman, we are going to make sure that we methodically and carefully recalculate what that need is, because we need to get it right, or at least more right than we did in July. We don't want to be giving you something that was as ultimately inaccurate that we gave you in July. And that was, again, our best estimate with the data we had at the time. Another factor was that our operational leaders across the organization managed to the budget by making key decisions to be able to achieve that. So we did stay within the FY24 enacted budget, but some of the actions they took are ultimately not sustainable. So, for example, deferring and delaying equipment purchases. We also anticipate continuously increasing costs in pharmaceuticals and prosthetics. Medical inflation is far exceeding consumer price index. And so these are cost pressures that the entire healthcare system is facing, Mr. Chairman. Normally, we project our funding needs through actuarial models called the Enrollee Healthcare Projection Model. Mid-year, we had to do an estimate run with a different methodology. We're now going to be using more up-to-date and hopefully more accurate assumptions when we calculate and deliver our funding need to you.
Mr. Chairman, on the benefit side, we estimate our cost requirements looking at the number of claims we anticipate receiving and producing, and that can be influenced by the total number of employees we have, their efficiency levels, the availability of overtime funds. On the education side, we're looking at economic indicators, trying to assess the rate of utilization for those education benefits, to include whether veterans and beneficiaries are using those benefits in a full-time or part-time capacity, online or in person. What we found in looking back at fiscal year 24 is the primary driver and the primary reason why we came to you and requested the additional funding is we updated our projections, assessing that we would complete 2.5 million claims, not the 2.2 million we had originally projected and thought was aggressive yet achievable. Well, it turns out we did in fact exceed 2.5 million claims completions. What we didn't anticipate is that the proportion of those claims was more heavily weighted on veterans receiving a claim for increase rather than new veterans getting a claim for the first time. And the cost differential there resulted in us not exceeding the amount of mandatory funding as we anticipated. The other point that I'll mention is that without the supplemental funding on the education account, we would only have carried over about 0.5% of our total funds, which would have meant that if we had had even about 5,000 more students utilize those training and education programs, we would have exceeded the total level. So as we look forward to improve on our budget formulation process, we're taking into account the lessons learned, increasing total production estimates, trying to dig deeper into the proportion of claims that are new versus claims for increase, and we're making sure that we also anticipate a greater growth in the average disability rating for veterans.
Thank you very much, Mr. Chairman. I'm going to come back to the shortfall and just want to begin by underscoring the concern that I raised in my opening remarks. President-elect Trump recently announced that Vivek Ramaswamy would co-lead a so-called Department of Government Efficiency, which sounds like it is not even actually going to be a governmental agency. And he's already made headlines saying that unauthorized programs should no longer receive appropriations. His precise words were that, quote, "We can and should save hundreds of billions each year by defunding government programs that Congress no longer authorizes," unquote. As you well know, veterans' health care benefits are currently not an authorized program. So if and perhaps my colleagues are unaware of that, but so if Republicans in the majority follow through on Ramaswamy's wishes, it will mean that veterans would no longer be eligible for inpatient surgeries, no longer be eligible for inpatient services like surgeries, acute care, and injuries that may require urgent care and outpatient services like health appointments, immunizations, and nutrition and education. Ramaswamy's strategy would strip this committee of our authority to determine how the federal government should be funded. All members of this committee should be outraged about that. It appears that we should be reminding the incoming administration that our nation's founders gave Congress the power of the purse. So Dr. Elnahal, my question is, this stated strategy would obviously have a devastating impact on our veterans. Can you further elaborate on what eliminating almost $119 billion in medical care would mean for our veterans?
I'd be highly concerned about it, Congresswoman. Right now, we take guidance from our general counsel and our authorities, and so we have a 1996 law that established a medical benefits package that clearly does state that our authority to provide care is related directly to the advance appropriation that we get every year. So we're pretty confident in our authority to provide the full scope of medical care. And we're in a position now because of the historic growth in the number of veterans enrolling in VA, but also the number of veterans who are relying on us more because we're doing things like increasing priority groups when Josh and his team out of VBA offer more service-connected benefits to these vets who are already enrolled. That is actually substantially increasing care demand. And so we'd be highly concerned about any cuts. In fact, we need to grow our workforce to a level of 405,000 employees as we estimate to be able to deliver that care in a timely way. Despite these increases in demand, we've seen wait times on average go down instead of up for primary care and mental health. We've seen historic performance on quality, patient safety, veteran satisfaction, and trust. We want to make sure we maintain those outcomes while we provide accessible, high-quality care to vets.
Thank you. And just to my colleagues on appropriations, we have a culture here that we're proud of that is, that there are Democrats, Republicans, and appropriators. And I mean, I think we all have to think through if this is a plan that actually is moved forward, about the number of laws that have expired, in a sense, and no longer have an authorization that we fund here, even without the authorization, which is our right and Congress's authority. And so it's just something that I wanted to make sure that I shined a spotlight on, because it would dramatically affect the Congress's authority more broadly, and specifically our authority as a committee. On the VHA shortfall, Dr. Alnahal, as I mentioned in my opening statement, both the increasing cost of healthcare and the uncertainty around the number of veterans with PACT Act qualifying needs who will be coming to rely on your services adds to the uncertainty in your cost estimates, certainly. And you, in your testimony and your answer to Chairman Carter just now, pointed to that, particularly in pharmacy and prosthetics. With the success of the PACT Act, can you give the committee some insight into how many veterans you're now serving and where the shortfalls exist? For example, what types of providers will you need to be hiring? And can you be more specific about exactly what costs are increasing and how that's impacting your ability to not just predict your costs, but to sustain a high level of care?
Yes, so we face systemic cost increases, again, as does every health system in America, Congresswoman, on pharmaceuticals, prosthetics, key elements of veteran care delivery that VA shoulders the responsibility for. We're a very integrated, comprehensive healthcare system. We have one of the largest pharmacy operations in the country. We bear those costs and deliver those needed medications to vets. And so we anticipate that we will see an increase. We observed an increase, I should say, of about 13% in pharmaceutical costs this last fiscal year. We're projecting an increase of up to 24% into FY25, both because of the intensity and volume of medications we're delivering, but also because of the newer types of medications for obesity that are high cost, but can ultimately help and serve veterans across the country. And so those are a lot of the systemic costs. When it comes to our full-time employee needs, Congresswoman, we have been relentlessly hiring frontline employees and clinicians and folks who directly serve veterans. The vast majority of employees that we hired at historic levels in FY23 were frontline employees. We are budgeting for physicians, nurses, housekeeping aides, food service workers, and the entire gamut of employees needed to make hospitals and clinics move to give veterans timely care. And that's really where we're going to be indexing should we be able to get these supplemental funds.
And just one more brief thing. How has the growth in community care impacted your budget, particularly as it relates to this shortfall?
Every single referral into the community is an added, what we call variable cost, and an added cost to ultimately the agency. Now, I've supported community care from day one in my tenure. Community care is absolutely needed for many veterans when we don't have a service available and when we can't offer timely services. It's actually the law under the Mission Act for us to be able to offer those services. What we've done instead of limiting access to community care is actually over-indexed and offered more VA care over the last fiscal year. So we're offering telehealth appointments, more in-person appointments. We are offering appointments between medical centers that more veterans are taking us up on, and veterans are voting with their feet. So between 22 and 23 and 23 and 24, there was a significant difference. It was 18% over the last period, and we grew by about 14.8% between 23 and 24. So we're slowing the growth of community care, not because we're limiting those options, but because we have a more robust workforce than ever. Our clinicians are becoming more productive, and we're offering a lot more VA options to vets, whether they qualify for community care or not.
Great, thank you. Thanks for the indulgence, Mr. Chairman. I yield back.
Thank you, Chairman. Thank you to our witnesses for testifying before the committee today. Like the rest of my colleagues, I'm incredibly concerned with the VA's ongoing challenges in accurately estimating demand, utilization, and costs, and reiterate the need for more transparent and detailed explanations what the VA needs to fulfill its mission of providing for our nation's veterans. I know it's been hit on a little bit, but even chatting with my colleagues on the authorizing side, there's a lot of concern. There's not a lot of clarity on the way that these are estimated. And there was a letter that was signed by our chairman here, Chairman Carter and Chairman Bost, specifically requesting quite a few different clarifications, and it sounds like there has been little to any response at all on those, and a lot of excuses. Any response to what's taking so long to give the answers to, 15 questions on there?
Congressman, I was under the impression we had responded, but I can go back and confirm if I'm mistaken. We certainly, as Dr. Elnahal mentioned, we have a constitutional responsibility to cooperate in a transparent manner to provide you with the answers you need to do your duties to the people you represent and to the taxpayers of this country. We owe you that, and we will commit to doing that. We will be transparent. We have provided monthly status of fund reports since the summer. Those will continue. And we are also complying with requirements associated with the supplemental appropriation you passed to provide reports detailing information about our budget formulation process.
After that supplemental was passed, we were under the impression, or at least it's come out, that it was no longer needed. When did you actually know that you didn't need those $3 billion?
We identified that after we had received the funds. It takes us several weeks to reconcile our accounts and make sure that we've identified things like prior recoveries and kind of all of the numbers. And so once we had verified that, we communicated that.
And so you knew a few weeks afterwards that you didn't need the extra $3 billion that was sent over?
The full complete. I think we had a sense of the CNP earlier, and the RB took a little bit longer, but then we had to reconcile and verify that.
All right. How does the VA plan to measure long-term outcomes and increase funding, particularly in areas like mental health, homelessness reduction, and caregiver support?
I'll take that one, Congressman. So the most important public health and clinical priority we have is veteran suicide. And so that's going to be, it continues to be the most important metric that we measure when it comes to the mental health and well-being of our vets. We also measure access to care. So we've been able to reduce average wait times for new patient and mental health by about 14.5% year over year from fiscal year 23 to 24, mostly because we hired thousands of mental health frontline clinicians to be able to see more vets. But also because we've been working on productivity and ensuring consistent standards on their number of patients seen per provider. And of course, we also have a large gamut of metrics on quality and reliability of care delivery when it comes to mental health, and we're happy to follow up with you on exactly how we're measuring those outcomes. I was just handed a note that says we did send back a 46-page response to the letter that you mentioned on November 8th, but we'll make sure we'll double back with you and your team on that response.
So from what I understand on the responses they've gotten so far, the numbers don't add up to the $12 billion that you're asking for. And
Yes.
That's a huge problem. I mean, when we talk about a number of $3 billion that was given and then not necessary, now there's a $12 billion request, but there's no clarification on what those needs are. I feel like we need a little more transparency on that. And if you can bury in a 38-page letter actual facts, I think that would be helpful on.
I don't disagree, Congressman, that our projections could have been more accurate. Conceded that for sure. What we're trying to do is make sure we work very diligently to make sure that the number we do give this committee is much more accurate. And that is taking time, and we're going to work as methodically as we can with OMB. But yes, the projections as of July were an overestimate.
All right. What mechanisms are you currently using to keep these numbers as transparent and accurate as possible moving forward?
We have monthly budget execution reviews, Congressman, with every single one of our network leaders. We have robust participation from our medical centers. We're tracking full-time employee levels, community care utilization, pharmaceutical costs, prosthetic costs, productivity, a number of metrics that are giving us much more real-time information directly from the folks managing our system. And so that information is available to this committee upon request at any time when it comes to our budget execution. I will say that a large part of the reason why we're here and we ultimately need less money this fiscal year is because our operators grew care significantly while holding down costs as much as they could responsibly. And so we're seeing wait times go down, we're seeing care volumes go up, and we stayed within the FY24 enacted budget, not by accident, but because we have excellent leaders across our system managing the costs very, very closely. And so that was an unexpected outcome, ultimately a good one because we have more resources going into this year, but our projections need to be more accurate.
I'm under the impression that one of the administrators at the department actually used the phrase swag, so scientific wild ass guess, as a way of some of the estimates that were projected and why they were so far off. And I think that was actually addressed in the letter. And I mean, that's a scary thought when you think about the billions of dollars that were being budgeted, spent, not spent, asked for. And then when you hear phrases like that from whistleblowers, I think that's a pretty scary thing for us, especially when we're all in the same room here. I think we all care about the same thing, making sure that we take care of our veterans. And the amount of money that's being thrown around is irresponsible for the taxpayers. A lot of veterans are taxpayers as well. A lot of them left services and go out in private sector and work hard, pay taxes. we want to make sure that we're as responsible as possible. And when we hear phrases like that, I think we owe it to our citizens to make sure we do our best to not play these games anymore. And I hope that in the response, we can find some of the answers to the questions I had and that the committee had. Thank you.
Thank you very much, Mr. Chairman. Dr. Hall and Mr. Jacobs, thank you so much for being here today, and thank you for your commitment to ensuring that our veterans receive the care and the services that they deserve. I greatly appreciate your service and your invaluable contributions to this important discussion. I really think that while there has been discussion about the overestimates of cost, I want to congratulate you because it appears to me that by any metrics of quality and care, that you have taken your mission to take care of those who have served very, very seriously. This committee for over several years now has insisted that we not come up short on care for our veterans, and even made it a part of our annual process to advance fund medical care for our veterans, to make sure that regardless of what exigencies might happen here on the Hill, that our veterans would be cared for. But by all of the metrics of performance, you've done a tremendous job, better than in many, many, many decades, and so I want to congratulate you for that. I'd like to associate myself with the comments of the ranking member, because I think that it is better to have the resources and not need them urgently than to need them and have our veterans come up short. And I think that you gave our veterans the benefit of the doubt in those estimates, and fortunately, budget-wise, you didn't have to expend it, but nevertheless, I appreciate, and I think our veterans appreciate, the fact that you had them in mind and you did not want them to come up short. So I certainly congratulate you on that. But I want to ask you, with the fluctuations and costs related to pharmaceuticals and your need for additional staff, the fact that your managers were able to cut costs to stay within the projected budget, but as you say, those cost-cutting mechanisms are not sustainable. You've got to invest in the future. You've got to hire more staff. You've got to anticipate the additional cost increases that will be coming for the quality of services and equipment that you have to acquire. What is it that we can do on this committee to give you additional tools to more accurately project and to make sure that we never ever have to come back for additional funds because we have targeted and have sufficient resources projected?
So I'll start, Congressman. I appreciate your comments very much. As the Secretary compels us to do every day, we are not going to relent on our outreach to more veterans across the country to give them their earned health care and benefits. And we've acted that way since the PACT Act was signed. We accelerated healthcare eligibility 8 years in advance of what was required for the law for different cohorts of veterans as of March 5th of this year, including every veteran who's deployed to a post-9/11 conflict, now qualifying for VA healthcare, every veteran deployed to the Gulf War, every veteran deployed to the Vietnam and expansive deployment locations. And that is the primary reason why we are here. We're given the authority to bring more vets into the system. Every single veteran we enroll, on average, reduces their risk for suicide, which is reason enough to do this.
Well,
But also,
I'm hearing from my veterans every day that they are really, really happy with the recent support that they feel from the VA. They feel like their claims are being addressed, that they're getting better care, their increases where they deserve an increase are coming quicker, the wait times are better. They seem to be happy, and the data that you supplied in your testimony indicates that the confidence in veterans is much, much increased. And so I really have to congratulate you for that. I think this administration has done a tremendous job in that.
Thank you, Congressman. But I know that we do need to work on our budget formulation, and that is something we're commissioning an external review to assess, and we're going to make sure our projections get better and better over time.
Mr. Rutherford.
Thank you, Mr. Chairman, and I thank our witnesses for being here this morning. I want to echo Mr. Bishop's thanks. As a Navy dependent growing up, my father was a World War II and Korean veteran, and I know what veteran benefits and all meant to my family growing up. I know Mike and Scott and others in the Appropriations Committee who have served this country and are veterans themselves. The future of veteran care in America couldn't be in better hands, I think, from an appropriations standpoint. Nobody is going to be cutting care to our veterans. Now, can we do it better? Sure, and we need to look at that. And I want to ask, because in my previous life, I had to put together big budgets every year, and something that I noticed, I could really hit it on the dime when it was simply carrying everything forward the way it had been for 10 years, 15 years. But when you throw in a new program like the PACT Act, that's where the swag comes in. I know. Now, it is scientific, but you try to base it on something. But you don't have those former events that you can really turn to gauge, what's the response going to be? You don't know how many veterans are going to respond to the PACT Act. And I first want to say also, I think y'all did an amazing job getting the call out to all the veterans, making them aware of the PACT Act existence even. And so, but not knowing how they're going to respond to that, for you to try and put together a budget, I know that's tough. And I think when you look at the size and scope of veteran health care and veteran benefits, I think y'all did a pretty good job, quite frankly. Now, there's also processes that are in place where we can do rescissions and that sort of thing. So it's not like the money's just gone. But I do want to ask you one thing, because and the reason I would rather see you overestimate than under is because I know how important, and I think you would agree, preventative health care is. Early health care, I have members in my family that have had screenings and things that have literally saved their life and saved the system a whole lot of money because they don't have to pay for the more serious illness down the road. So my question is, the PACT Act and the call that you all put out, getting these folks in earlier, getting to them more quickly, 4 years, I think, versus 8, those kind of changes. Is there any projections on, and it may be too early yet, but are there any projections on how much is actually being saved by addressing these health needs earlier by the clarion call that y'all put out?
Yeah, Congressman, so we believe that preventative care is the best care, and that was one of the main motivations for us to accelerate healthcare eligibility under Section 103 of the PACT Act, which you granted us as an authority under that law. And for the first time for many, many veterans, they no longer had to prove that they needed to have a service-connected condition to get access to VA healthcare. The benefit of the doubt on their need for healthcare was given to the veteran for the first time for millions of additional veterans. And so we could say for the first time to those veterans that we can be there for you in a preventative posture rather than waiting for you to get sick and ultimately get granted service connection before we treat a condition you already have. We'd much rather
Exactly.
be in a preventative posture, as you mentioned. Now, in terms of projections on cost savings, that remains to be seen. This is a historic piece of policy that will be thoroughly analyzed into the future. But the main motivation, Congressman, as you know, isn't cost. It is preventing illness and prolonging the life and allowing veterans to thrive across the country.
Congressman, I would just add, as we look at the 2 decades leading up to enactment of the PACT Act, our obligations for the compensation and pension account grew at an average rate of 8%. In the 2 years since the law was enacted, it grew at 17% and then 16%. So there's been tremendous growth. We carried over significantly more money in the last 2 years at about a 10 and 11% rate relative to what we had done previously. We obviously were a little too tight in this past fiscal year, and so we'll work to apply those lessons moving forward. But your point is a good one. The PACT Act has fundamentally expanded our ability to deliver more benefits to more veterans and survivors. It's an incredible authority, but it's challenged us with respect to budget formulation, and we'll make sure we apply the lessons learned moving forward.
Thank you. Look, linear projections are easy. Dynamic projections of what human behavior is going to be is tough. And quite frankly, I think y'all did a good job. Thank you. I yield back.
Chairman, thank you, and to the ranking member also, and I want to thank our witnesses for being here. And I certainly want to thank you for all the work that you do for our veterans, so I want to say thank you. My question goes on the shortfall. I know it's been asked, but I want to ask it a little differently. So in July 2024, y'all projected a $15 billion budget shortfall. Then it was revised in November to $5.1 billion. That's a shift of about a little bit over 20 billion. Not 1,000, not thousands, not millions, but billions. That's a large amount of discrepancy. And I got serious questions, if y'all can write down the questions. What measures are being implemented to enhance the accuracy of future budget forecasts and prevent similar situations is one question. And in that, what internal controls are being strengthened? It's the second question, to ensure financial accountability within the VA. And to go into some of the questions, I assume that the financial projections were influenced by 3 things: lower than expected workforce costs, I assume. If that was one, delay equipment purchases, I assume that was another one. Slower growth in community care, I assume that was another one. But my question, when you talk about the measures to strengthen internal, I assume y'all are using the internal control systems within the standards set forth by the GAO, that is the Green Book, the Standards for Internal Control of Federal Government. I assume y'all are doing that now. I assume also that y'all are conducting your yearly evaluations on internal control systems to comply with the Federal Managers Financial Integrity Act of 1982 to make sure that we have the effectiveness and the efficiency in operations, reliable financial reporting, and of course, compliance with applicable regulations. And I assume also y'all been implementing the OMB Circular A123 also to do this. On the measures, and I say this to my colleagues, 14 years ago, we changed the law to ask you to do performance measures. The only thing is I couldn't get across was I was trying to add this to the appropriations where we could actually have an input. And we can still do that, Mr. Chairman. Right now, the way the measures are being done, including cost savings, they're left up to the agencies to, in many ways, pat themselves on the back because they'll put certain measures that are a lot easier to achieve. But I hope sometime we can talk about where Congress can have have a say-so on the measures that include cost savings. If we put in $1, what do we get for $1? what are the cost savings? And I haven't seen your measures in a while, but a lot of the measures we're looking at were just measures of activities and not results, or results oriented, and I think you know what I'm talking about. But anyway, I have a couple questions that are down the line as the chairman and the ranking woman also, but I'm want to ask you about some of the internal measures.
Absolutely, Congressman. Just to clarify one thing, we had estimated a potential need in FY25 as of July to be $12 billion for VHA. We have not yet submitted what that revised number will be. We know it will be lower, potentially substantially lower. Again, based on all the factors I mentioned, our operators managing as closely as they could to the budget and ultimately staying within the enacted budget, affording us the carryover approximately that we had estimated originally in the budget. But then there are also elements that we expect, like increased pharmaceutical, prosthetic costs, and other systemic factors in healthcare that will factor in to that ultimate need. On the budget formulation review that we're doing, as Congressman Rutherford mentioned, dynamic factors in play here. We hired a huge number of people, unprecedented number, all-time record of more than 60,000 people in FY23, precisely to prepare for robust implementation of the PACT Act, because we were also doing an unprecedented outreach campaign to bring more veterans in. And so even if we are off by about 2% in the cost per FTE, which is approximately what we were off by as of July versus what we know now, that translates into well over $1 billion of difference in the actual outcome. And so we're really looking at these factors. We want to make our projections as better and ultimately more accurate, but there's a very dynamic last few years in play here. We're also just finished our audit with the OIG on complying with all of the different parameters that you mentioned. And so we're taking that. We've improved year over year, but there are still things that VA needs to work on. And of course, we welcome your oversight and accountability on outcomes. Our most important outcomes are veteran trust, which stands at an all-time high of 92%, quality and patient safety outcomes, which VA outperforms the private sector by 60%, getting the top 2 grades versus 40% of the private sector. And of course, access, wait times are down, primary care and mental health. And when it comes to actual care delivery, we are up significantly, breaking records every year in appointments delivered.
And we thank you. My time is up, Mr. Chairman, but if you recall, in the state of Texas, we actually did put performance measures where we actually sat down with the agencies and looked at them, and there's a way we can add them to the report language at least, so we can see customer service, like you mentioned, and thank you for a good job on that. You can look at cost savings. There's a lot of things we can do, and maybe next year we can look at some of that. And Florida also has done that also. I know Texas and Florida, and probably the other states also, Nebraska and the other folks have looked at this, but it's something that we should start thinking about having a say-so on performance measures. But with that, thank you, Mr. Chairman, Ranking Member, and to both of you, thank you for what you do to help our veterans. Thank you.
Ms. Bryce.
Thank you, Mr. Chairman, and I want to thank Dr. and Mr. Jacobs for being with us today. I first want to say that it's disappointing to hear the ranking member politicize this topic. No one is suggesting that VA benefits are going to be cut. No one's suggesting they're going to be eliminated. The next administration will do everything they can to ensure that our veterans' care is a top priority. It didn't happen under the first Trump administration, and it's not going to happen under the next one, so I think it's important to point that out. I want to talk about a couple things. First and foremost, the budget relied heavily on unobligated funds. You all had quite a bit of that. Can you talk about what specific factors led to the assumption, and why were these risks not highlighted to Congress early on?
Are you referring to the medical care carryover that we budgeted?
Correct.
Yeah. So this has been a consistent pattern of advanced appropriations over the last many years, where for reasons that I think are very veteran-centric, you all have authorized funding for us that would more than complete the needs for the current fiscal year and then carry over a substantial amount into the next fiscal year to minimize the risk that ultimately the agency would run out of money. And so,
What percentage would you say are these unobligated funds?
yeah. So in terms of amount, we're approached about $12 billion that we carried over into this fiscal year, out of a denominator for this fiscal year budget approaching $150 billion. And so, it's
8%.
it's a substantial amount. And, again, I think the point is to make sure that we're well resourced. But because of the PACT Act and because of historic care delivery rates, we are going to be requesting additional funds. It's just not going to be $12 billion, and that's what we're working out right now.
Thank you. In a 28 October 24 report to Congress, it was identified that the VA still needs to hire about 5,000 additional employees, specifically for mental health care. Did you hire fewer medical employees this year than anticipated?
We think we need to hire more employees, Congresswoman, than we were able to this fiscal year because we had a budget that was tighter, just like every other agency under the Fiscal Responsibility Act. And so that is why we came forward in July saying, we know we're going to need more employees. This is what we're estimating to deliver timely, high-quality care. We still think we're going to need about 405,000 employees into the next fiscal year, which is higher than what we are currently at right now. And we, again, are going to be over-indexing, and the vast majority of them are going to be frontline clinicians and folks directly serving veterans.
Did you slow hiring because of your budgetary concerns?
We had to. We had to slow hiring. Now, we were still thankfully able to maintain better access, good outcomes. We're concerned, though, about our ability to do that if we don't get additional funds this fiscal year, which is why we came out in July with that request.
Was slower growth in community care because providers weren't available to provide the care, such as dental or specialty care, for the new priority veterans that were adopted into the program?
It's so we're dealing, Congresswoman, with significant growth in community care year over year. So that's the first point. We're talking about 14.8% in 24 compared to 23, 18% from 23 to 24. So we're all talking about growth across the board. We were able to slow that growth not by impacting eligibility for community care or denying community care to veterans, but rather by offering more VA options reliably to veterans, thanks to the hard work of our employees across the system. So every time a veteran now qualifies for community care, we attempt to also say, here's a telehealth option, here's your in-person option, and empower the veteran with the choice. We want the veteran in the driver's seat, choosing where they get care next, and if they choose the community when they qualify, we have to honor that, and we should honor that.
You mentioned at the beginning of your testimony that there were 1.7 new enrollees and increased priority rankings. What was your estimate for each of those initially?
So we were not sure exactly how many veterans would take us up on this. So that's a big variable that was hard to predict. Right now, we're close to 70,000 veterans enrolling because of the Section 103 authority alone. And we are now well over 800,000 veterans enrolling since the PACT Act was signed. And so what's interesting is that if you take our most recent data up to where we are in November right now, we're actually 47% more enrollments than the equivalent period before the PACT Act. So if anything, we're potentially accelerating that growth. And the fact that we increased priority groups for veterans was actually an accelerant to get more veterans qualifying for dental care, long-term care, for folks who ended up in the highest priority group. So that's a whole set of services, some of which, especially long-term care, is very costly, but we're still going to do it, and we're obligated to do it because that's what these vets have earned.
And if I can with my closing, give a shout out to Wade Vlasich, who is the VA director back in Oklahoma City, who is doing an absolutely remarkable job of making sure that my vets back home are well taken care of. So shout out to him. And with that, Mr. Chairman, I yield back.
Agree.
Mr. Franklin.
Thank you, Mr. Chairman, and thank you to our witnesses for your time here with us today. And I'd like to echo a lot of the comments my colleagues have already made. When you get to the end of the dais, a lot of those questions that I had originally have been touched on, but it also gives me a chance to kind of assimilate and assess kind of what I've been hearing. And I really do hope you all understand the significance of this. I mean, you put us through big hoops to try to get money appropriated. Our phones lit up back home. We had veterans scared to death thinking they were going to lose all their benefits. And it turns out that this was all in a big budget screw up, really. Dr. Elnahal, I do appreciate your comments that we need to get it right. You're looking at an outside group to come in and help do a review, and that it's important to work hard to improve the accuracy of these projections. I fully agree with you. I know you've had service on the private side and the public. You know, in the private side, you don't have the luxury of missing budgets like that. You just don't. In the government, we can always make it up. We just create money out of thin air and we press on down the road. So it's always easier to underestimate and have carryover than to miss your budget. And Mr. Jacobs, I get it. I understand your point that we can't afford to miss. We're certainly not going to leave our veterans hanging. But to say, you know, it's a risk we're not willing to take to under budget by $1. And you made the comment about it being prudent management. I guess I just want to understand, do you feel that this whole episode was prudent management?
Congressman, when we identified the updated projections that identified the potential need for additional money, we had a couple options to make. One, which we chose to do, was to elevate the risk, to communicate it, and to seek the funding, knowing that if we're even $1 over our spending cap, we would have to delay benefits for all nearly 7 million veterans and survivors. Unlike other mandatory programs, we don't have authorities to provide such sums as are necessary. And so we're limited by that fact. We considered a couple of other options. One is we could keep our head down, hope everything worked out, and pray to God that we didn't exceed the cap and have to come to you telling you that we're going to delay payments, because we know the impact that would have on the customers we serve. The other option we considered was, okay, maybe we can slow down benefits so we don't hit the cap. That's what I assume would happen in the private sector. That wasn't an option we thought was fitting with a veteran-centric ethos of delivering more benefits to more veterans. And so I'm certainly not happy with the way things turned out. In an ideal world, we wouldn't have to come here. I spent 10 years working in Congress. I worked for an appropriator. I know how significant it is to make a request of this nature and to secure the funding. I'm incredibly grateful for you, for everyone, for making this happen. And we want to make sure we apply the lessons learned moving forward so it doesn't happen again.
So it sounds like some of the brakes you did put on, though, were reducing the pace of hiring personnel and the equipment, bringing on new equipment?
On the benefit side, we did not. All of the funding we're talking about was dollars in the pockets of veterans, families, and survivors. And I'll defer to Dr. Ellenhall to speak.
Yeah, I'm interested in the equipment purchase delays because, here it is, we're in a new budget year, and the safe thing to do, if our standard of performance is to never screw up and be as safe as possible, are we holding back on these equipment purchases now because it's early in the new fiscal year, and then we may get to the end of this fiscal year and we're kind of worried again, so we kick the can on down the road? What kind of equipment are we talking about, and what are we suffering by not making these purchases that have been appropriated?
It ranges, Congressman, from some of the more most complex equipment we have at our medical centers, upgrades, maintenance, entirely new equipment to deliver complex surgeries and high acuity care, to more simple things like the rising costs of CPAPs and home devices that veterans need. We're anticipating significant cost increases, as is every other healthcare system across the country. And so it's why we know we're going to need additional funding.
So why once you got the extra appropriation and then you realize, whoops, we really didn't need all that money, why not make end of the year equipment purchases? Instead of rolling it forward, why not execute the things that you thought you were going to do at the beginning of the fiscal year?
I think, Congressman, what was enacted as a supplemental was the veterans benefits money for compensation. I don't know if you want to comment on that, Josh.
Okay, I understand.
Yeah.
Different pot of money,
different
right?
pot of money.
Yeah, got it. All right, thanks, Mr. Chairman. I'll yield back.
So, I have a question just popped up. Who's doing the external review?
We're still trying to secure the folks who are going to do that on the outside. It's going to be contract-based, and it's going to look at our budget formulation processes. And so once we have that available, of course, we'll share it with the IG, we'll share it with this committee. We're committed to that.
And Mr. Chairman, the Inspector General is also conducting an independent review of our budget formulation process. I believe that's a requirement of the law you enacted.
Review, but
yes, sir.
He's very competent, very competent. Well, with all the issues that we've got that we're not getting the information, then AI lies out on the perimeter, and people are gonna start speeding things up. I don't know if you thought about that or not. But one of the things that, we knew all about this, you knew all about this back in July, all right? Now, if I understand AI correctly, it's like it goes boom. I mean, it just instantly covers every kind of information you ever wanted to know, maybe something you didn't want to know. I'm totally ignorant as to what it does. But so far, I've seen 9 or 10 people come talk to me about getting it, and everything has to do with speed. Speed is very important. I think I want you to at least be thinking about the fact that you're overwhelmed without speed. And if you don't get accurate numbers, and I figure a way to get accurate numbers with speed, then that's going to make it even worse. And I fear that for appropriations too. Consistently, we're moving money around when we have the opportunity to move money around and aren't on a CR. And if we speed things up, it's going to be a lot harder to get this thing all figured out. And I think that's the real reason all of us are saying we've got to be kept current. $1 billion is to the American public is a tremendous amount of money. $15 billion is almost beyond anybody's comprehension, and $1 trillion is beyond anybody's comprehension, except the people that deal with it. So when you realize that, and I loved what he said, what we have to realize is there's nobody staying more current on what's going on with the VA than our veterans. They pay attention. They belong to organizations that keep them informed. And the minute they see something they think might be going wrong, they light up the telephones all over this country. And good for them, I made a mistake one time when I was my first trip overseas, and I went to Korea, and I just decided I'd be smart and hold a town hall meeting with us. Whoa, was that rough? Those soldiers, they knew exactly what they wanted to ask me, and although I appreciated it and I enjoyed doing it, but I mean, these guys pay attention to these current events because it's their livelihood, to a lot of them. Just like people on Social Security pay attention to that, people on Medicare pay attention to that, because if something goes wrong, they're left out in the cold. And I understand with a lot of talks going on, but I don't think I can guarantee you that I'm not going to be standing for anybody trying to abolish anything to do with our Veterans Administration, and I don't think my colleague is either. We are with you 110%, but keep us informed. And I hope the external audit, or whatever you want to call it, is going to give you some information about tools you can use. Because, I know we haven't mentioned it, but we're in an inflationary period right now. That gives people the ability to raise prices above a legitimate value in some instances because of inflation. I know the cost of this weight lossing drug because I'm using it. It's $1,000 a month. That's a lot of money, but I've lost a lot of weight, so I'm happy. But bottom line is that we've got medicine is hard to deal with, but the shock of a number and the coincidental shock of the number right after the presidential election was confirmed looked very political, to be honest with you, and very concerning to the people on this side of the aisle. A day after the change is coming, And you people are subject to that change, and we know that. Those kind of things bring politics into it. And you shouldn't bring politics into this. So I ask you to please, I'm not gonna have a question, I'm just gonna make a speech. I ask you, and if you don't, then I'm gonna be really mad. I don't get mad very often, but when I do, it's pretty dangerous. So please, I'm asking you, and then I'm gonna be over there knocking on doors if I don't get the answers. I'll yield back to my friend and colleague, Ms. Wasserman Schultz.
Thank you, Mr. Chairman. I just want to make sure I underscore that I'm absolutely going to be pointing out concerns that arise as a result of the decisions of the incoming administration or the projections about decisions of the incoming administration that affect our veterans. That's our job. So when we have a leader who has been selected by the incoming president, who has specifically said that any unauthorized program would be recommended for elimination of their funding, it's important to point out here in a public hearing the impact of that on our veterans, which would, as I mentioned, be very significant. There's nothing political about that. And to just paint a brush and say, well, we didn't do that in the last administration. It wasn't proposed in the last administration. It is potentially going to be proposed in this one. And if that's the case, as appropriators, we need to be aware of that. It wouldn't only affect veterans programs. There are hundreds and hundreds of unauthorized items that we fund here. And Congress has the power of the purse. So it's not political. It's a respect for the system of checks and balances and the way the Founding Fathers established our role in the Constitution, which specifically gives Congress the power of appropriations and exclusively gives us that role. So that having been said, I want to just ask a question about women's health, because obviously we know women make up the fastest growing group of veterans that are enrolled in VA healthcare, but many of their healthcare needs go unaddressed. And I know VA has been working to address those problems. You've made some progress in hiring gender-specific providers and addressing harassment at VA facilities. Can you talk about that progress in hiring providers that specialize in issues like intimate partner violence, military sexual trauma, maternity and newborn health services, and what more needs to be done? And can the VHA shortfall and where you come in around what you're going to need address funding some of those needs?
Yes, Madam Ranking Member, absolutely. We've been prioritizing women's health, fastest growing demographic by far across the system. Our Office of Women's Health reports directly to me, the Undersecretary, and we've been able to preserve the support and the resourcing for women's health providers even throughout this more difficult budget time. In fact, we have specific purpose funding, thanks to your enabling legislation, that requires us to do that. And so that funding was distributed in part to retain our essential women's health providers throughout last fiscal year, but also to hire additional providers. And we have the same exact program going into this fiscal year. That's actually agnostic to whether or not we get this money because of how important this is. We need to make sure that we are catching up to the demand of increasing numbers of women veterans enrolling, broke a record just this last year with more than 50,000 women veterans enrolling in fiscal year 24. And we hope that number gets even higher because of our targeted outreach. Our programming has also only accelerated our women's health mini residencies for providers who had not been used to seeing women. Historically, there were fewer women in the VA, and many of our clinicians have been in VA for a long time. Our efforts to bring in more gender-specific care, more GYN specialists, more access to mammograms in the VA, but at the very least, coordinating breast cancer screening, maternity care coordination. We made a move to provide more coordination for women veterans up to a year after birth rather than just 8 weeks. That was a change we made last fiscal year. And we've been much more expansive about how we talk about screening and mammograms to women vets across the country. So this remains a priority, will remain a priority as long as we're here and we can continue to push it.
And the VHA shortfall, is there any way that we can address some of the resources being directed to address those issues?
Absolutely. I think the shortfall, if it's filled when we get you all a number, will allow us to net grow our full-time employees. And so, of course, women need the full gamut of medical care, and they will benefit from increasing numbers of physicians, nurses, and other frontline providers that will be as essential for women vets as the rest of our veteran population. But we've been able to preserve our investment in women vets even throughout these more difficult budget times.
Good. And then, Mr. Chairman, again, flagging things is not politicizing them, but the incoming administration has not been shy about its plan to indiscriminately fire and harass federal civilian employees. I really want to underscore that doing that will be directly attacking veterans. VA has the second largest number of civilian employees among all federal agencies. Maybe some members don't realize that. Second only to the Department of Defense. It includes VA doctors, nurses, dentists, social workers, mental health professionals, pharmacists, people working to streamline electronic health records, our cemetery caretakers, many others. And additionally, when considering the entire federal civilian workforce, 30% are veterans. So cutting the number of civilian employees means cutting healthcare and other services for our veterans. So, Dr. Elnahal, can you talk more about how civilian employees contribute to VA's mission and what it would mean if a subsequent administration follows through on a plan to reduce the civilian workforce and how that would impact our veterans?
Well, about a third of our employees, Madam Ranking Member, are veterans themselves. So many more have a veteran in their lives, a spouse of a veteran, a caregiver, take the mission personally. And where we've increased our staff has overwhelmingly been for frontline employees and employees carrying out our essential programs like veteran homelessness. We've been able to bring veteran homelessness to a record low since we started measuring it because we've been able to preserve and staff up on our homelessness program teams in the field. We're now offering support and care to more caregivers than any time in the history of the VA. About 80,000 caregivers benefit from one part of our programming or another. And all of this is on the backs of our excellent employees. They're the ones executing this mission. And so I'd be concerned about broad brush approaches to reducing the workforce. That would have to be a very methodical effort. But right now, we estimate that we're going to need more employees and not less.
Right. Thank you. And thank you both for your service to our nation's veterans. I yield back, Mr. Chairman.
Thank you, Mr. Chairman. And first, let me begin by saying, I represent Northeast Florida in Jacksonville, St. Augustine, and I can tell you our veterans are very appreciative of the health care that we receive in Northeast Florida and the attention that they get. The challenge that we have is our VA Medical Center, the closest VA Medical Center is in Gainesville, which is about a little over an hour away. So our VA healthcare clinics, like the Leo C. Chase CBOC down in St. Augustine, very important to us because of the distances to the other facilities. We've got a little situation, I'm gonna get a little parochial here, but we've got a little situation where I think because of their upfront folks the numbers are not there. They're short-staffed is what I'm hearing. That the phones are being rolled over to the Villages Clinic for answering. And what that's doing is a lot of our veterans who access them by phone, normally looking to get those community care referrals and things, they get sent down to this clinic down there just for the phone answering, and either they never get the message back at the CBOC or the people that they're talking to down in the Villages clinic can't help them. And so they're not getting the service, obviously, because of this phone transfer system. I'm sure it's happening probably all over the place. So my question is, what can we do to help hire those frontline people that really, I mean, that's the door in. And so, you know, do you hire through through staffing agencies? Have you tried that? Is there, you know, what can we do to get these offices manned?
So I did get a heads up, Congressman, about your concern on the St. Augustine CBOC and the call center. I conferred with our network director over EventID, which is Florida, this morning. And he told me that we'll have at least two new members of the call center team at the St. Augustine that will serve the St. Augustine CBOC within the next couple of months by the end of January. Right now, it's being diverted to the Villages call center because they do have the capacity to be able to take these calls. But you prefer to have folks who are closer to where the veteran gets that care and have personal relationships, ideally, with the clinicians delivering that care, which is why EventID is going to staff up. So that's a concern we'll follow very closely. And more generally, Congressman, this is why we are coming forward with a supplemental funding request for VHA. The more resources we have, the more frontline employees like our essential call center employees who are serving vets every single day to be able to meet that need. So yes, this is not only an issue in your area of the country. We need more medical support assistants and call center employees. That's part of where, if we do get the supplemental funding, that's part of where it will go.
And did I understand you correctly that you missed it by 2% on the salaries and benefits, and that's $1 billion, right?
Yeah, so in general, we stayed actually about $240 million below what the enacted budget requires overall. When it comes to a big variable about why our estimate was off as of July, we estimated the cost per FTE to be about $158,000 per clinician. That's skewed quite high because of the number of physicians we have.
2% off.
Yeah, and we were 2% off. Ultimately, that number came down to 155,000 as of the end of September. And when we got that data, that 2% difference translated when you over 400,000 employees to be a very high dollar amount in the absolute terms.
Yeah. Thank you. I think y'all doing a good job. Thanks.
Thank you.
Pardon me. We appreciate it very much. You communicated well with us today, and we're asking for this to be communicated well, either by when we write you a letter or whatever, with the kind of information you've given us. So thank you for what you've done. And remember, we all are here to support the veterans of our country. And there's no one on this committee that's trying to do anything to wipe out our veterans or the veteran care. And we will be soldiers in the field fighting on your behalf if something like that comes along. And I will remind anybody that so far, I haven't found any agency that is authorized. Maybe somebody knows one, but I can't think. The State Department's not authorized. There's a lot of people who aren't authorized. The Defense Department's not authorized. I mean, it's kind of an amateur's, no offense, an amateur's comment about the government. We could spend about 2 or 3 sessions authorizing people if we wanted to. We probably should, just to get back in the real world. But you're talking about just about the whole government's not authorized. So that's another politics I'm trying to point out. Listen, thank you very much for doing this, and I remind the members, if you have any questions you want to submit them to us within 7 days to the subcommittee. And with that, we thank you very much for your time. Subcommittee is adjourned.